Okay, heroin is a major problem in the central Pennsylvania region. And before I took the bench, I always pictured heroin users as some nefarious person hiding in an alley in New York City, shooting up with a syringe. But that's not what I found. It's everywhere. It's your typical user is not that person hiding in the alley. It's kids, your coworkers, family members, throughout. Most people that appear before me either are in remission, they're in rehab, they're actively using, not remission, I guess they're in relapse prevention. Or they have someone that they know that's in that. It's everywhere. I would say almost every day I also read in the paper that you'll see someone who was involved in a heroin drug bust or a heroin-related death. We're here today to talk about this epidemic, and it is an epidemic. We have a distinguished panel today. Judge John S. Kennedy has been a trial judge since 1996. He was my sponsor to the York County Bar Association. Since 1997, he's worked with addicted individuals in various capacities. Judge Kennedy has been on the leading edge of establishing specialty courts in Pennsylvania. In 1997, he helped establish the York County Drug Treatment Court. It was then the only second treatment court in Pennsylvania. In 2002, he helped launch the first reentry court program. In 2012, Judge Kennedy undertook the expansion of the DUI treatment court. He currently oversees orphans court matters and treatment courts. He's been married to his wife Beth since 1987. His daughter Logan is 26. She resides in Colorado Springs, Colorado. She's married and a computer engineer. His son Christian is 18. He worked for Penn Waste as a garbage loader over the summer. And he's also a ski racer who is about to leave for training in Chile later this month. Tom Kearney serves as our current district attorney, having sat in that capacity for about 12 years. He is the chief law enforcement officer of the county. Tom has jurisdiction over all felony, misdemeanor, and summary offenses. In addition, he's responsible for providing legal guidance on criminal matters for various police agencies and county departments. I assume he sees Officer Kaylee frequently. The district attorney seeks justice for crime victims and community members while aggressively and impartially prosecuting crimes that occur within this jurisdiction. His office takes a three-pronged approach to the issue of illegal drugs, consisting of education, prosecution, and treatment. He resides in Springinsbury Township with his wife Diane and has 3 grown children. Pam Gay is York County's coroner. She took that office in January 2014. She is a registered nurse for 33 years and is certified in forensic nursing. Pam's focus is on reaching out to survivors of loss and educating the community regarding health trends in York County. She also works on preventative measures that can be taken to reduce deaths due to suicide and substance abuse. Pam has been married to her husband, Jeff, who's also present today, for 31 years. They have 2 grown children who are married and have 2 grandchildren. Please help me welcome our distinguished panel.
Thank you for allowing us to present this topic, which is probably not the lightest post-lunch conversation, but we really appreciate the opportunity to be here, and I'm going to try and keep my remarks brief so that we give you all plenty of time for questions, and obviously want to give the others time for comments. As you heard, I've only been in office since January. When I first came into office, I anticipated that we had a suicide problem in York. I anticipated that we had a prescription drug problem in York. I knew there was a little bit of a heroin problem, but within the first week, I quickly learned that heroin was one of our bigger problems in York County and was fast becoming the biggest problem when it came to drug abuse. I actually started within the first few weeks working with my chief deputy to sort out what had previously mostly been classified as opiate deaths, with sometimes heroin recorded. But we started single-handedly going through those cases, case by case, manually going through them, rereading the tox reports, and trying to figure out who actually tested positive for heroin. We quickly learned that in 2011 and 2011, our heroin deaths were numbered at 12. In 2012, our heroin deaths were numbered at 17. And in 2013, they stayed at 17. But I was starting to see a trend that was picking up, and so I was concerned about that. Year to date, right now, as of today, as of yesterday, when our latest facts came back, we have 30 confirmed heroin deaths already in York County, with several months to go in the year, as you know. And when you compare that to the first 6 months of last year to the first 6 months of this year, it's approximately 189% increase in 1 year. We are meeting pretty much the trend that you're seeing throughout the country. In some ways, we superseded, especially with some of the smaller counties around us, and we are among, as far as the Class 3 county, we're among the highest per capita for heroin deaths. Our youngest decedent was 17 years old. Our oldest so far is 53. You can see we have a broad range. Generally, what we see is people in their 20s to 40s most of the time. And as Judge Strong shared, we're seeing from all walks of life. This is not your typical what you might have thought of in the 60s and 70s. These are people who are functioning members of society as much as they can function. They have children, they have parents, some of them live in their parents' homes, some of them are using in their parents' homes. Their children find them. We actually had a case a couple weeks ago where children found their parents. So it's heartbreaking. I have opiate addiction in my family. It crosses all socioeconomic levels. We're trying to get the message out to people so that they understand that if it hasn't hit your family yet, it will, unfortunately. We hope it won't, but it very well could with the odds the way they are right now. So we want people to understand that there is a face behind all these numbers. There are families who are torn apart. There are multitudes of people that are affected by one user. And we want to try and figure out maybe some ways that we can start to tackle the problem. So we're out in the community talking. My chief deputy and I actually did a presentation with Dave Sunday from the DA's office a couple weeks ago. Some of you have heard about it in Little Crossroads. A United Methodist Church asked us to come and speak, which I thought was very gutsy of them. And we had about 40 people there. A lot of them from Delta were very concerned about seeing it in their own front yards. And just trying to figure out some solutions. DA Kearney's going to talk about some other things that we're doing in the community, but one of the things that we specifically have focused on in the coroner's office since February is we're doing autopsies on all heroin deaths, suspected or known. That is the trend, and that is recommended by the National Institute of Justice. It's actually the trend that you're seeing in all the other counties. We were a little bit behind with that, so we just felt that we wanted to get on task with that to see if that could help with prosecution. We met with the DA's office. They felt it would give them a better chance at prosecuting. I must tell you, a success story already happened. Actually, we've had several, but this one actually just happened yesterday. We had a heroin overdose. I was meeting a lot of resistance. I won't go into the detail, but it was actually somewhat very stressful on my staff and me yesterday in the morning about not doing. I was basically meeting resistance against doing the autopsy. We went ahead and chose to do it. Found out this morning from the police department that they've already made an arrest and found a dealer. So that autopsy's been done. That autopsy will show that nothing, hopefully, nothing but the heroin caused this decedent's death. And that's why we do the autopsies in these cases, because it helps provide for a better prosecution. Because if you don't do the autopsy and you only do a blood test, then it comes back and they say, well, how do you know they didn't have anything else medically wrong with them? So it was just a great feeling. I felt validated with all that we went through yesterday. That's what we're doing in the coroner's office. We're also working in some other areas that DA Kearney will share with you in a few minutes.
It's not often I get to correct a judge without taking an appeal. But I've only been in office for 5 years. Maybe it seems like I've been there forever. Perhaps we're looking that up, and may have gone to my time when I was a young line prosecutor as well. I'm told that last month you dealt with the middle-aged wasted 45 minutes, so this should be a piece of cake. The first thing I want to stress is that heroin is not limited, the heroin explosion is not limited to York County. We have had discussions in my statewide organization. We meet twice a year and behind closed doors to discuss the issues in our state and how we're dealing with them. This has been a topic of discussion and concern by the DAs across the state, and from what I read, I also believe it is nationally. And it's come from a lot of things. It's come from the availability of the drug. It's come because of its cheapness. It's come because of people cracking down on the pill mills that we have. When you crack down on those, people look for an alternative, and then heroin is much cheaper on the street. What you can get for $45, $45 you get for $5 on the street by going for illegal drugs. So, it's a real problem all over the community. Now, we tried to sit down internally and taken a look, and the judge did get it right regarding what we're trying to do. The first thing we've done is take an educational approach. Pam talked about the fact that within a week she became aware of the problem, and that's because we were down in her office within that first week explaining to her what we believe we saw, and begging basically for her office to begin the process of conducting autopsies so that we would have the tools we need to begin prosecution. In short, we were very worried about the people that were supplying heroin, or bad, not that there's good heroin out there, but bad heroin, which was causing the deaths that we were starting to see spike. So in order to prosecute, we need to show cause of death, and the only way we do that is through an autopsy being conducted. So Pam agreed, and it's not without some difficulty because that's a cost to the community to conduct these autopsies, but it is necessary in order to get these prosecutions. So, kudos to her for having the guts to do that and deal with the commissioners and getting the funds to do that. Kudos to the commissioners for recognizing that needed to be done. But in any event, we were down, we discussed partnering with her to engage with the community. She spoke about, one of the things I think we have duties as prosecutors to do is to engage with the community. And it's very important that we get out there and interact and learn. So our prosecutors are now going out publicly doing things, events such as this, and all over our community. There's a real lack of knowledge out there about how do you identify your kids, if they're using drugs? How do you pick up on that? And what do you do when you find out that it's happening? Where do you go? One of the things I learned, and maybe this is a nice segue into the big thing we're starting to do, which is the heroin task force. Some of you may have read about that in the newspaper. This is a collaboration with segments of our community to educate not only the community, but ourselves. And one of the things that I very quickly learned by speaking to people in the medical community, I just learned last week when we had our second meeting, was the lack of resources available in our community to deal with the problem of drug abuse. There aren't many places to go, and maybe it's the NIMBY syndrome on my backyard. Maybe it's the regulations. So we're actually going to be bringing somebody down from the state to talk to us about that, to see what we can do here to get treatment, which is really the third piece of what Judge Kennedy is going to talk about with our treatment courts. But there have to be places to go where medically people can be treated, and there's a real lack of that in our community. So this is the Heroin Task Force is basically designed so that we can educate not only community but ourselves by bringing together a cross-section of people who deal with this issue. Everybody from those frontline medical people to community people who have suffered deaths as a result of drugs and can fill us in on the personal side, to political leaders and members of law enforcement. Some of whom were in this room who are members of that organization. We're going to try and put up a website so that we can provide answers to the community as to how to do these things. And also to help people to get rid of drugs. I mean, one of the ways that young people especially get into drugs is in your own medicine cabinet. If you have old pain medications, maybe you had some condition that required a pain treatment, which was a controlled substance, and you still have that bottle laying around. There has to be a place to get rid of these things. And the police departments, and many of them have them currently, but we are trying to, through the Heroin Task Force, have most, if not all, of our police departments have a place where you can just go and put them in a box, and they're later taken up to and incinerated, so we can safely dispose of pill medication waste, and also keep it from our children who tend to take that and maybe sell it at school or something of that nature, even if they themselves are not using it. So these are things we're trying to do to educate. We've also taken a firm role in prosecution. You know, we have a whole unit of district attorneys who are devoted to nothing but felony drug prosecutions. And that's critical because they know the statutes, they know the law, and it develops more success. You know, we've collaborated with area municipalities to bring officers into the Drug Task Force, which has countywide jurisdiction, to assign them to work primarily drugs in their community, but also take a strategic approach and say, okay, today we're going to Newberry Township, or today we're going to Spring-Sperry Township, to approach this on a countywide strategic basis, and to develop this this approach to interdict drugs in quantity, which is what I think the Drug Task Force should be designed to do. One of the things we've done is we discovered, not discovered, perhaps this was, I didn't discover this, but it became apparent to me that many people use their cell phones in order to text their drug dealers and get that. When we go to these, we go to the death scenes and we find a kid with a needle sticking out of his arm. Okay, there's usually a cell phone laying around. And when we pick up that cell phone and we're able to crack that cell phone and find out, what we many times will find is that they texted their drug dealer, and that's how they got the drugs. And we have actually gone then and done the same thing with the dealer not knowing that this individual had recently died, and been able to actually go and obtain to a drug deal for that same person that maybe 2 hours before had supplied drugs. And we've been able to make a number of arrests on that regard and charge people with drug delivery resulting in death. You know, there's a cultural thing that has happened. We're working very hard to change that. People will, an officer will go to a scene, he's very busy, they're short staff, and they find somebody, that individual with a needle sticking out of his arm, and they say, okay, no crime here, a coroner's problem. You know, nothing I can do about it. Well, that's not true, and to change the mentality of line officers, administration and a number of police departments, York City being one, is we're working very hard to try and change, you know, that thought process, because there are a lot of things you could do, like talk to the guy's roommate, or pick up the cell phone, or, you know, conduct an actual investigation. So we're trying to work that, and we ramped up our forensic cell phone lab to allow us to crack these cell phones in a very timely fashion so that we can follow through with that. And we've also worked very closely, as I said, with the coroner to charge those who supply drugs and get the tools we need, such as autopsies. And once we have the evidence, now we can show the cause of death without beyond dispute. Finally, we were working very hard through the Forensic Task Force to change some laws. One of the things that is critical, there are a couple of bills that are right now pending, and the state legislature has only 11 working days, I believe, before the end of the year. The ability to, there is a drug, I think, I'll refer to you, I think it's
Naloxone or Narcan.
Naloxone or Narcan, which it will instantly reverse the effects of narcotics. So if and it's used widely in an emergency room. Unfortunately, with many people, we can't get to an emergency room in time. So allowing EMS people to have it, or allowing, you know, if you know that your kid is going to is on drugs and try as you might, you can't get them off it. You know, to have that thing can really in your home can save a life. And you know, I think anything we can do to save a life, I think we should make an effort, a real effort to do. So that bill is pending up there. It's I believe it's Senate, it's House Bill 2090 and Senate Bill 1164. before. So if anybody has some contacts in that regard, there's also a good Samaritan aspect to that. Because what we find is that many people are sitting around using drugs and they don't call the police when somebody goes into overdose because they're afraid they're going to get in trouble. And in fact, as we have a duty to, if we find drug paraphernalia around and many people are using it, we have an obligation to charge them. Now, how we handle that afterwards is another issue, and we, the goal is to try and get these people help. But there is a bill. It's a good Samaritan thing saying, hey, don't charge somebody, because they call when somebody's dying from an overdose, and there's aspects to that. Finally, the last bill that I'm really concerned about, and I think really needs to accomplish, is what is called Senate Bill 1180. It's a drug. What it does is it expands the drug database. It's probably not widely known here, but we have 5 schedules of drugs, and only the first and the second schedules. The first schedule, there are no drugs that are legal, but the second schedule is only those 2 are put in the drug database, and there are many schedules in 3, 4, and 5. Many drugs which are addictive, such as Suboxone, which is a maintenance drug for heroin, Vicodin, a lot of widely used drugs that are gateway drugs that we would like to have a database on, so that we could make a determination if, for example, doctors are way over prescribing these medications, or patients are going from doctor to doctor to get these medications, and we'd like to be able to access that if we have reasonable suspicion to believe that someone may be abusing. This doesn't give law enforcement carte blanche to get into somebody's medical records, nor do we want it. But I think these are controlled substances, and therefore they need to be controlled by the state. And law enforcement does need to have the tools to look at those things if we believe with reasonable suspicion, and we would have to get a court order to make that examination. So there's some prevention there. So those are the things we're doing in addition to treatment, and I'm going to let Judge Kennedy speak to that. But I did want to say with treatment, that I think this is a very important aspect, so much so that we are, one of the things we're doing is helping to fund the drug treatment courts that we have in our community, which is something that is new here in York County. We didn't do that before I took office. We have our office very actively participates in the treatment courts here in our community, and we've done all we can to encourage expansion, because statistics tell us that this is the one thing that works as far as helping to get people off drugs, and that is supervision and support structures. So I'm going to turn the mic over to Judge Kennedy.
When does your meeting usually end? Upstairs at 1:15? Till 1:30? All right. I was going to cover a number of the things that Tom covered, but the one thing I've noticed in my career, and I think one thing that's really contributed to this epidemic, is the people who manufacture the heroin have started to make it much more pure. And I believe that was done intentionally, because there's a lot of folks out there who certainly don't want to stick a needle in their arm. So heroin was purposely they started to make it more pure so people could snort it. And a lot of people will begin to snort it thinking, it's not as offensive as putting a needle in your arm, but it quickly turns into injection. The other issue that we've seen is I've seen an awful lot of deaths that have occurred because of the combination of heroin and a drug called fentanyl, which is used for cancer patients. It usually comes in patch form, and we've seen a lot of issues where addicts will get the patch with fentanyl and continue to use the heroin. They claim it increases their high, or there will be ways of attempting to extract the drug out of the fentanyl patch and mix it in with the heroin for injection. So we have those issues. I agree with Attorney Kearney that the prescription drug database would be great. The Narcan is a super idea. The idea is to actually have that in police officers' cars as well, first responders' vehicles, so that when they arrive on scene, they can do that. The good news is that treatment, when it's done right, does work. And what we've also noticed is that, and it's not what we've noticed, it's what has been researched and what has been proven, involuntary treatment is just as effective as voluntary treatment. So someone who is sentenced into a treatment court or into a treatment program or required to do it by court the success rates with those folks are just as high as the success rate for folks that voluntarily go into treatment, provided they finish. Most of the folks that come into our treatment courts do indeed finish. And the folks that actually finish the treatment, do it the way they're supposed to do it, you're looking at somewhere around a 70% success rate for folks that will not go back to treatment. With that said, we saw treatment cuts last year in Pennsylvania for dollar amounts for drug treatment services cut by $11.5 million. The sad part is we have the money in the system to take care of the problem, but Pennsylvania is well behind the curve. In my drug treatment court training, we have a philosophy, it's called using the case method. It stands for copy and steal everything. And that's what we do when we find something that works, and that's what treatment courts do in general. States like Texas, Virginia, Michigan, states that you wouldn't think of as being particularly liberal, those states enacted comprehensive criminal justice reform, where essentially what they did was they stopped locking up violent people. In Pennsylvania, we're still incarcerating an awful lot. They stopped locking up non-violent people. We want to lock up the violent ones. But in Pennsylvania, we're still locking up a lot of non-violent people. We're sending people to state prison for years for retail thefts, for forgeries, for many crimes that, while they're done to support their addiction, are not crimes that you would think you'd need to put them away with the robbers and the rapists and the murderers. Pennsylvania's prison budget continues to increase every year. Our population was, I think, stagnant for about a year. It's generally the #2 budget item in the state. Education's above it. After that, we spend the money on corrections. And states like Texas and Virginia and Michigan, what they decided to do was front-end load the system, start to put more money into treatment, start to expand their treatment courts throughout the state. They decided to stop locking up the non-violent people, and lo and behold, they save the money. Their budgets for their correction department drop. But what's even more important is their crime rates drop. Public safety improved. Now, if I could go into a business arena and say, I've got a program here, and for 1/4 of the cost, I can sell you something that's going to be 3 to 4 times as effective, it would sell like hotcakes. Unfortunately, Harrisburg doesn't work that way. So they are starting to wake up, but it's a major issue. And we have the solutions if we can get people to listen.
Okay, we wanted to give people some time to ask questions. We don't have a whole lot of time, but
how do we recognize the symptoms? How do we know someone's driving under the influence or the child is using heroin?
well, I can go over some of the symptoms of heroin. I will tell you, we have a very detailed presentation that is, Chief Deputy Staley and I do for free in the community, and like I said, the DA's office is involved with us in some of that too. So if any of you want that presentation, we'd be glad to offer it to your venue or whatever organization you represent. But I briefly just tell you, for heroin, you'll probably see some paraphernalia around, and the insulin type syringes, the real thin TB syringes are what we see. You'll see lots of packets of foil if they are smoking it or snorting it, because they use the foil to put the heroin into, and they smoke it off of there. If your kid's room has a lot of residue, or somebody, I mean, I'm not just talking kids, I'm talking 20s, 30s. If there's a lot of dark residue in the room, that's because they're smoking or smoking it, basically, because it's got like a lot of thick tar in the heroin. Some heroin does. They're gonna have a whole different set of friends than what you would ordinarily think, maybe have no kind of tie to them. People that they're meeting somewhere, just some of the subtle signs, they go through withdrawal approximately every 12 to 24 hours. So they're constantly trying to get more heroin to basically keep from being sick, and that's what they're doing. And so if they can work actually and function, they take heroin before they go to work. They come back, they take heroin again, or they take it right before bed. So it's not that hard. And a lot of times it's denial, unfortunately, or a family just doesn't want to believe that that's what their kid's doing. But there's going to be obvious signs. You just have to look for them. And You know, it's an opiate, so they're going to be sleepy looking, droopy looking at times right after they've used. But yet they can function, and sometimes it's hard for parents or family members to believe that their kid's doing it. I mean, the one yesterday, that was part of the resistance. I had, you know, 60-year-old parents who couldn't believe that their 30-year-old was using heroin, you know, and it's difficult. It's a huge family dynamic involved, and you know, you'll see money missing all of a sudden. You'll see your own prescription drugs missing because they take them along with the heroin. And you know, there's a lot more I could go into, but those are just some of the things that you're going to see. So.
We'd be pleased to come back and do that presentation if you'd like us to do it.
Yes, I'm sorry.
Do you think that the increase in heroin deaths are because there's an increased usage, or because there's an increased access to what the district attorney calls bad heroin?
I think it's an increased usage, actually.
I agree.
Are there any statistics that give you a general idea for every death, how many users there would be, to get an idea of what the impact is in our community?
We're actually working on that right now with the DA's office, some intelligence there. We're developing a map, and you may actually see a map in the media, in the papers soon, because they're working on the same kind of map, and I think it's like a race, sort of, to see if we can get the map out faster. But one of the things that we're doing is we're comparing the deaths to the criminal activity or arrests, basically, in prosecution. So we are working on that. That will give us at least a better idea. But unfortunately, the statistics in our state have not been the most accurate for the last 5 to 10 years with heroin, but it's changing. It's changing. Over the last 2 years, it's going to get better, so that we'll have a better idea of where the problem is. But those are very good questions.
Let me just follow up. The reporting has not been real good across the state. And it was through that as a result when we worked through an organization called CJAB, which is the Criminal Justice Advisory Board. And one of the things that we're doing, as Pam said, is to address that specifically in our community. And we're developing that information through the records that we have and comparing it to the records she has. So we don't have those statistics yet, but we'll work on it.
One thing that's changed is we're filling out a drug report on every drug death now for the first time this year. And that's just among the coroners. And it goes into detail on every single drug, because most of these are not just heroin. Most of them, they die from the heroin, yes, but they're on all their antidepressants at the same time, as well as sometimes they're using coke on top of it. But coke is minimal now compared to heroin. Heroin is definitely overshadowing coke as far as the cause of death.
The thing you will see on the autopsy reports is mixed drug toxicity, and that's rampant.
Do you have statistics confirming the oft-stated principle that a large percentage of the heroin and hard drug users start out on marijuana? The gateway.
I don't know that there's a lot of statistics on that at this point. I will tell you that most of my decedents do not die from marijuana. I'm not proponent, I'm not a big, I know that's a law enforcement issue, but I will say that marijuana is not something that we see a lot in our heroin users. We do see it a small amount, and it's very difficult to die from marijuana.
I just meant it's a gateway starting there.
I know that there's a lot of talk about that. I think that some people would say yes. I don't know if there's a lot of statistics right now, do you know, that support that necessarily?
I don't know statistics. My sense is that I had a biology teacher one time who said figures don't lie, but liars figure. So you can structure the statistics the way you want to do it. My sense is, and this is anecdotal, that many of the people who start out, they start out with marijuana, but is that because the marijuana makes them go on, or is that because they're risk takers to begin with? And so, I'm not really convinced, and I don't have a sense of actually why that happens. But, we do see, a lot of people who have used marijuana in the past. That doesn't make it a cause and effect thing in my mind.
It's a good question.
Dan.
Let's take one more question. Yeah, several years ago, there was a push to get a methadone clinic in actually Springfield Township, and that sort of fell through. And the rationale was they were taking everybody to Harrisburg to get treatment. Has that been established, and does methadone work And the second question would be, what I learned a lot at that point in time was, and I still believe this, is that people that can afford these drugs don't live in the city, live in the suburbs a great deal. And people don't think that it happens in the suburbs, but it does. But if you would address both those points.
Yes, a lot of people think it's a city problem, and Chief Cayley will tell you, and I will tell you, that it's not just a city problem. It is a huge problem in the entire county. As most of the other police chiefs will tell you, they have it in their county. So it's all throughout York County. You know, in the suburbs, you know, we do have some pockets of activity, you know, like in the Hanover, Delta, you know, some of those areas, but we've seen it in most any township just about, or borough. It's a real big problem. And in regards to the question, methadone. We actually had this conversation at the heroin task force meeting. Learned that Pyramid Healthcare and White Deer Run are the only clinics that offer any treatment for heroin addiction in York at this point. The only treatment centers.
Is it effective?
Yes. The feeling was we actually do have addiction specialists on our panel, and they felt that it is effective and that it's not near enough. There are not near enough treatment centers to handle the number of heroin users in York County.
And one of the things we learned from the medical community is that many people, when they feel a need for some reason to detox, they will go to one of the hospitals and feign that they have suicidal ideations in order to get admitted, and then they can detox. So people have to lie, actually, when they go to a medical treatment facility to get treatment, because then there are three of what are called 302s, which is a section of the Mental Health Act, and they can detox. And so that's of concern as well.
There is a drug out there as well called, I believe it's now naltrexone, that's injectable. It lasts for 30 days, and essentially if you inject the heroin when you're on that, you won't get high from it. So it kind of counteracts the heroin. That's been used in treatment in a number of other parts of the country. It's really gaining popularity. Unfortunately, it's about $1,400 a month. So we're not seeing much of that in York County.
Judge Kennedy, Coroner Gay, District Attorney Kearney, thank you very much for taking time to come and meet with us and speak with us today.